There's actually more people than you might think that do not know how to take their medication correctly. But it's not just following a prescription. Some people don't understand what their doctor is explaining to them. They nod without understanding. They don't know how to fill out medical paperwork. And some are unable to name or explain why they are taking their medication. This issue has been seen persisting throughout our healthcare system. We see this right now. We spend trillions of dollars on cutting-edge medical treatments, but health outcomes are still shaped more by whether people understand their bodies, their systems, and their symptoms. Health literacy is the missing treatment in public health, and we have been ignoring it for far too long. I hope that today I'm able to convince all of you to learn more about your body, your health, or the healthcare system that you, a part of that you have ever been confused about. But first, let's define what health literacy really is. According to the Centers for Disease Control and Prevention, health literacy is the ability to access, understand, use information and services in ways that promote and maintain good health and well-being. Now, this is more than just being... There's actually more people than you might think that do not understand how to take their medication correctly. Some people don't even know what their doctor is explaining to them. They nod without understanding. They are unable to fill out medical paperwork. And they don't know the name of their medication, or they can't explain why they are taking them in the first place. This issue has been seen persisting throughout our healthcare system. Right now, we spend trillions of dollars every single year on cutting-edge medical treatments, but health outcomes are still shaped more by whether people understand their bodies, their symptoms, and their systems. Health literacy is the missing treatment in public health, and we have ignored it for far too long. I hope that today I'm able to convince all of you to learn more about a part of your body, your health, or the healthcare system that you've ever been confused about. But first, let's define what health literacy is. According to the Centers for Disease and Control Prevention, it's the ability to access, understand, and use information and services in ways that promote and maintain good health and well-being. Now, this is more than being able to access websites, read pamphlets, and follow prescriptions. This includes being able to navigate and understand basic health information so that you know how to manage your own health. This is about understanding when symptoms require medical attention, navigating health insurance and referrals, and understanding preventative care. The Center for Healthcare Strategies says nearly 9 in 10 adults in the United States struggle with health literacy. This confusion goes beyond race, gender, age, income, and geography, because health literacy is universal. We are exposed to health information quite frequently, whether it's on the news, social media, or the internet. But that information has not led to much clarity about our health, because we are exposed to misinformation. When people cannot tell the difference between what is evidence-based and what is not, they make risky choices about how to manage and treat their health. Right now, health literacy is measured almost entirely on a person's ability to read a prescription's bottle, but it fails to recognize that person's ability to apply their knowledge and to a real-life scenario. For example, let's start asking whether that person knows when their symptoms require an urgent care or an ER visit. Do they know how a referral works? Do they know the importance of preventative care? These types of questions can actually tell us whether someone is able to navigate the healthcare system or not. how does not having health literacy impact our healthcare system at large? Well, this leads to people being reactive rather than proactive. Instead of identifying symptoms and going to a doctor, they wait until their situation becomes a crisis, where they don't know the difference between a normal symptom and something more serious. And this leads to complicated surgical procedures and ER visits, which can be extremely expensive. In fact, a recent global study by economist Impact and Halion found that improving health literacy could save the US healthcare system up to $78 billion every single year. Now for the individual, that cost is even more impactful. That same study found that a person with low health literacy faces annual healthcare costs up to 3 times higher than a person with high health literacy. The impact is clear. Health literacy saves money, and it saves lives. But to understand why, we must look to our DNA. Health literacy is essentially what we use to control our lifestyles, such as our environment, behaviors, the type of food we eat. All of these things act as molecular switches for turning our genes on and off. However, when we are exposed to carcinogens or bad diets, this leads to abnormal DNA methylation, which is when tumor suppressor genes are silenced. But this process is reversible. Methylation inhibitors can actually activate tumor suppressor genes, which can lead to the death of cancer cells. Our daily choices impact how our body functions, and when people start understanding this, they can make better informed decisions regarding their health. But this is why preventative screenings are so important, because they give us insight into what our current molecular state is. Pap smears or colonoscopies can find precancerous lesions, which are cells that have started mutating but have not formed a systemic tumor yet. Through these screenings, we can actually catch these issues when they're still localized and treatable, and before they start spreading throughout our body. For example, let's take a look at colorectal cancer. There's currently a rapid rise in diagnoses of colorectal cancer for adults under the age of 50, which has led to a reduced screening age of 45. High health literacy is needed to recognize early symptoms rather than ignoring them. When people understand why the screening is necessary, this can quite literally be the difference between a localized and treatable procedure and a life-threatening diagnosis. The gap in this understanding leads to a difference in survival rates. Data from the American Cancer Society says for patients with early-stage breast cancer, the 5-year survival rate for localized and early detection is over 90%. However, when low health literacy leads to a late-stage diagnosis after the cancer has spread, that survival rate can decrease dramatically. This trend is also seen in other chronic diseases such as type 2 diabetes, where effective self-management is needed for improved health outcomes. When a patient has high health literacy, they are understanding how they manage a biological system in their body rather than just taking a pill. A study published in the journal Cancer found that patients with high health literacy on the screening lived 9.4 months longer compared to those with low health literacy. While care for cancer is extremely complex, it's important to note that health literacy is a risk factor when it comes to survival rates. We also have to recognize that health literacy looks different for every culture. Western medical frameworks often fail to account for the fact that different cultures have different health beliefs, practices, confidence in systems, and stigma in various health issues. Rather than creating health education for these communities, we need to be co-designing with these communities. A study by the National Institutes of Health found that culturally tailored diabetes interventions in Hispanic populations have shown success in improving health outcomes by addressing specific cultural practices, dietary habits, and language preferences. By ensuring health literacy efforts actually resonate with these populations, we are providing them with the ability to make more confident decisions about their health. Access to healthcare is important. But access to understanding healthcare is just as important. This means that health literacy is equally essential as access to treatments are. We first have to use a teach-back strategy, where the healthcare provider asks the patient to explain the care plan to them in their own words before they leave that facility, to prevent misinterpretation or confusion. We next have to implement health education into our education system itself, so that we can teach the youth about how to navigate their health from a young age. And lastly, we have to standardize health literacy tests to ensure that patients actually understand the why behind the treatments and the care that they receive. We must stop overlooking health literacy and start treating it as the life-saving intervention it truly is. Thank you.